wonderful. It's always great to have an amazing doctor on the show. We have so many, I call them social media doctors lately, since COVID-19. There's a lot of them out there. They all went to Google University, which I guess is a much shorter time than you probably had to go to medical school. But they're all experts and they probably know more than you. Just ask them, they will tell you. So it's good to have a doctor on to answer these questions. So to kind of backtrack to what we were talking about before you came on, we were talking about the reigning WNBA MVP from the Washington Mystics, Miss Elena Del Don, just put out this very touching op-ed talking about her struggle with Lyme disease and recently tried to get excused so she could also collect her paycheck, falling under the collective bargaining agreement that her Lyme disease, she didn't want to take a chance and be in these close quarters with everybody on her team, and 3 doctors who she's never met, have never seen her, deemed her safe to play, even though her physicians say otherwise. Now, Lyme disease, I don't know very much about, so maybe you could kind of, we'll get back to Elena. I just kind of want to preface this for the folks watching, but kind of, can you give us, you don't have to go, don't doctor us with the Lyme disease explanation. Don't, remember, we're not doctors, so we'll look at you. I'll give you that stunned look, like, I don't know what you're saying. No, but give us the kind of Cliff Notes version of what Lyme disease is.
Sure. I mean, I think the best thing to do is just to break it down into 2 parts, okay? So there's acute Lyme disease. Somebody gets bitten by a tick. Sometimes they find the tick, they get a bullseye rash. That is a classic finding of Lyme disease. They do not need a blood test. They'll get treated with antibiotics. If they get the appropriate course, they're done. Some people don't get the bullseye rash, unfortunately. They have symptoms, and you hope that they get still caught pretty early and treated, and they're done. What I think is important to note is that those group of patients are going to be fine, generally speaking. We're talking about patients who don't know they have Lyme disease until it may be too late. They wind up with damage to different parts of their body, particularly their immune system. They often have other infections that are also transmitted by ticks or other insects or viruses that they may have had as children and young adults. And so it becomes a chronic problem. It's sort of like a soup of infections and immune dysregulation. And those are the patients that may be at increased risk for things like COVID-19. And that's the question at hand. Are they at greater risk? And I would argue that they may be because of the issues with fighting this infection.
Okay, that makes sense. That was my next question was, so obviously this disease leaves you vulnerable. You fit into that category from day one of COVID-19. You are at risk. So I don't know what, it goes back. We'll go back now to, this poor WNBA player. Again, the lack of respect for the WNBA that's a whole nother conversation that I'm not going to drag a doctor into. I could get my sports mind onto it. Brandon Steiner, one of the biggest names in sports. We had a very long conversation about the WNBA in a past episode here. But this is just another slap in the face. Here's somebody who's worried about their health. Other athletes in other sports are allowed to do this. Buster Posey being one. He just adopted 2 young children, him and his wife, young twins. He opted out of his season. He will still be paid. Trevor Ariza in the WNBA, in the regular NBA, he had childcare issues because he was supposed to have a son during this time and wasn't willing to give up his time with his son as he goes through a nasty divorce. And then you come here, it's medical. She says, I have Lyme disease, it's proven. And these folks are like, hey, you have to play. And now here's somebody forced to put their life at risk for a paycheck. And mind you, they are not a first responder. They're not a healthcare provider. They're not law enforcement. They're not a cop. Law enforcement, cop, same thing. They're not military. They're not essential, yet they're being told you have to play. I mean, what is your thoughts on her having to do this as somebody who was an expert with Lyme disease? Now you have a player who's worried about COVID-19, and here she is being forced to go in. And let's also preface this that the WNBA does not have the same protocols as our friends in the NBA who have this beautiful bubble at Walt Disney World. They're forced to stay at the finest resorts at Walt Disney on NBA money, and they have really huge protocols why these ladies are thrown in basically a Motel 6. I don't even know. I think they're having like in Utah, they're having their camp. It's like horrible. It's like they're not even in Vegas where they can have all the top-notch stuff. And now she's going to be we're seeing COVID-19 tests popping up everywhere, even in the bubble. So, I mean, what does she do?
Yeah. I mean, first off, I was really appalled by the situation that she's in. It's hard to imagine, as somebody who's treating patients like her all the time, that others would argue against the doctors who know her best, right? She's very clear and open about her disease and the struggles that she's had. She clearly does a lot to be able to get on the court and play basketball, right? So that's at a good time, right? When we're not in the middle of the pandemic. But can she perform the way she wants to perform while risking her life? And the fact that people are arguing, and these doctors are arguing for her taking the risk is unfortunately, I hate to say it, sort of par for the course for what I'm seeing. Many patients in her position, whether they're famous or not, are in this situation where they are not taken seriously. They often look good on the outside. So, you look at her, you think she's an athlete. How bad could she be, right? This is the problem. This is an invisible illness. This is not something that you can see on the outside all the time. And so, can't we give patients like her the benefit of the doubt, because we have doctors who are testifying to her illness, that have been treating her for years, who know that she's immune compromised to some extent, right? So, from a medical perspective, and I'm sure, look, there are lots of other perspectives, right? There's there may be some discrimination going on, right? I hate to say it, and there may be, some other political things going on. I can't speak to that. Yeah. I can just speak from the medical perspective, that she's in a position that she should be put in.
Awesome. So let's talk a little bit more about Lyme disease. I was reading in the New York Times 4 days ago, published an article that was basically said somebody tested negative for Lyme disease, but they really did have it. And how it presents itself. And obviously it's summertime and all of us are out and about now. If we can be out of our house, as long as we wear our mask, we're out and about. How do we, number one, avoid, what are some ways to avoid getting Lyme disease? I guess there's some simple ones. It does present itself a lot like COVID-19, but so this is a two-part question. We'll answer the first one, how do you prevent it? And then we're going to talk about how do you know you have it. So we'll kind of jump, we'll come back, but kind of answer the first, people are out. So I know we're going to have to deal with people out hiking, biking, swimming, everywhere ticks seem to love. Right? They're everywhere. Right. So kind of break that down. What can people do to prevent having this kind of exposure to it?
I think about it sort of like with COVID-19. You're supposed to leave the house with a mask on. You have to think about that, right? Yeah. Same thing. You're going to go out and you're going to enjoy yourself in the outdoors. You have to think about it. Ideally, you have an insect repellent, either with DEET or with picaridin. Are my two favorite chemical ingredients, if you must. Those can be very preventive. They need to be reapplied. But again, you go outside, before you go, you put your insect repellent on. Ideally, you've also sprayed your clothes with permethrin, which is an insecticide. Ahead of time, you've thought about it, particularly if you're going to be in wooded areas or places where there's tall grass. Those are the places where ticks are going to be. But I've had patients get Lyme disease literally walking across Central Park in New York City. Okay, so you can get it just about anywhere, and those ticks are out, and they're every year increasing in numbers. So you have to use your head, be prepared, wear protective clothing, and protect your skin, and put the insect repellents on. That's like at the basic level. That's what you need to do.
Cool. That's perfect. So basically, make sure you wear a mask. It's funny how that continues to be.
That's it. Exactly.
Weird how that keeps coming up. I wish other people would catch on. It seems so difficult that way. I keep getting medical professionals. So let's pause for a moment on Lyme disease and let's talk about masks. You are another medical professional on our show. So I'm going to ask the question because I have a lot, again, experts, and I say that loosely, experts on every social media will tell me I'm wrong when I say, well, I keep interviewing doctors. I haven't met one of you that's like, no, you don't need to wear a mask. Masks have been worn where disease are prevalent for a very long time. Third world countries, being a Marine, been to a few. People were rocking masks long ago. Why are people fighting masks here? As a doctor, you should be, you believe people should be wearing masks when we're outside doing things in around large groups, because COVID-19 is not some made up thing. And we're not going to go political on this, but it's real. You're a doctor. You have,
Sure.
trust me, you got the chops. The schools that you went to, I mean, John
Thank
Hopkins
you.
is not a small school that's just, you buy that degree online. No. So,
Right.
so thoughts on masks, not
Right.
making it political. We're
Right.
not asking you to be political, but your thoughts on mask wearing.
Yeah. Look, I will concede that they're not always very comfortable, right? And I understand that for some people, there are issues. What I say is this: it's unfortunately not about comfort. It's about exposing others, right? The masks are protective mostly for others in case you are carrying the virus. There is some protection to you as well, and maybe again if both parties or all parties are wearing masks, that's the best scenario and decreases transmission. What I say is, look, find a mask that might work better, right? If you don't like the mask, you feel uncomfortable, you're worried about wearing it. I have patients who are sensitive to certain materials. Sure, so then find a mask that works. But it's not debatable. We can cut down the spread of COVID-19 in this country if we follow these simple rules. And one of those rules is wear a mask. And so, we've been doing it forever. I don't love I would certainly love to sit in a room with a patient without a mask. That's my favorite thing to do, is see my patients. And I have, really strong relationships with my patients. And that's part of the therapeutic thing that we do is to be able to talk and see expressions. I wear a mask. Patients can't see my expression. I can't see their expression. It's not ideal by any means, but I'm protecting them. They're protecting me. And that's the reality we're in.
I love that you said that. Yeah, they're not comfortable, but they've become fashionable. I know that you can wear,
Yeah.
I have a couple different color ones that I wear when it depends on what color shirt I'm wearing. You can coordinate with these. I mean, it kind of goes with your shoes. You just match your mask. And you don't have to wear it all day. And I keep seeing people going, well, if you wear a mask for 8 to 12 hours a day, I'm like, who's wearing a mask that long? I mean,
Right.
you're not supposed to be out of the house that long unless you're doing something that needs you have to wear it. But you can go to a store. You're not spending, unless you're my daughter who's 16 and you shop like she does, then perhaps you can spend 8 hours at a mall. But the rest of us aren't going to do that. So I just think it's funny, and it's good that you brought that up. So we've checked that off the bat. So let's go back. Well, now we covered the PSA portion of today's show about wear your mask, and now we'll go back to Lyme disease because it's fascinating to me, and having you here is so. I've read articles, even out of New York, that they say that it is possible. There's a few doctors who are saying Lyme disease treatment can also be an option for COVID-19. Have you heard this or have any thoughts on this?
Yeah.
Okay.
Yeah, absolutely. Early on, there were people looking at these drugs. They have an effect on the immune system. One of them was hydroxychloroquine. It got a lot of press. I'm not going to argue whether it's good or not for COVID. It's still very unclear to me. Having said that, it is an immune modulating medicine. I use it for Lyme patients who have arthritis because it can help with Lyme arthritis. So it is a drug that I'm very familiar with. The other drug that they came out as potentially helpful is Ivermectin. Well, Ivermectin is an anti-parasitic drug. Many Lyme patients have parasites. So I use Ivermectin quite a bit in my practice. So it's interesting that there is an overlap with the drugs that we use. In addition, I come from an integrative background. So a lot of the things that I'm doing for my Lyme patients or just my patients in general is about boosting the immune system and protecting. And I'm using things like vitamin C, something called NAC or N-acetylcysteine or glutathione. And now we have some publications to support the use of those things. And because I think the bottom line is, I talk about this a lot with my patients who are suffering with infections like Lyme disease. And I say, is it about the infection or is it about the host that's hosting the infection, right? You've made it sort of pretty comfy in there, and the bug has sort of taken up space, and now and they're wreaking havoc. And now we need to make sure that the host doesn't host the bug anymore. And it's the same with COVID. So if your immune system is better, if your body can deal with the infection by using these various protocols, medications, vitamins, etc., then it's going to be, you're going to be better off in the end. So I think that's the bottom line. It comes down to, at least from my perspective, protecting yourself the best you can. So it's not clear if any of these things treat the virus per se. I think they actually help the immune system.
Okay, awesome. See, that's good that you cleared that. So 2 questions and then we're done. I promise this will be fast and easy, or well, however long you answer them. But I also just read that there's also folks, NBC News is reporting or concerned that COVID-19 will lead to a Lyme disease boom because they present themselves so similar in symptoms with the fever. Again, I'm not a doctor, so if I'm wrong, I'm going off what the media says. So I'm that guy. I'm like, the media said, so doc, you could fix it. But I mean, I understand there's one of the symptoms, one way you could tell if you have Lyme disease is you get that bullseye, kind of the ring of, that looks scary as it is. I don't want that on me. I mean, but that kind of looks like a spider bite too. I've seen people have those and kind of, so it sounds like it's really hard to do. Do you think that this could lead to a boom? Because we can't, everybody's paranoid of COVID-19 and then you have Lyme disease. They're very similar, it seems. I mean, how, so 2-part question and then we're done.
Yeah.
Do you think that this will lead to a boom? And 2, what are symptoms that folks should be aware of that they could be like, I need to seek? Because one thing I see everywhere, you've said it, you've written it, I've watched your interviews, you have to get this diagnosed like fast, ASAP. Like, don't waste time not going, I don't know, maybe I'm cool. It's normal to have a bullseye on my arm. No, it's probably too late. So 2-part question. 1, do you think we'll see a boom? And 2, what are some symptoms folks should immediately see, look for, and go, okay, I need to seek medical attention right now?
Right. So again, the symptoms, the early symptoms of COVID and Lyme can overlap. So that's where it becomes complicated. The Lyme disease, sure, can present as a bullseye rash. That happens probably in less than 30% of people. So there's going to be a lot of people who are not going to have a bullseye rash, but are going to have nonspecific symptoms. I think the reason we might see a boom in Lyme has more to do with the fact that with COVID-19 and not allowing people indoors for a lot of activities, people are going outdoors. So people who never hiked before are hiking. People who lived in the city are now in the countries, right? And they want to be in the outdoors. That is what's putting people at risk, because these are the people who may not even be aware of the precautions they need to take. So I think that's number one, that we're going to see this increase because of that. The other problem, again, is diagnosis. So we're going to see an increase in people who are sick, and we're going to need to figure out how to test. COVID testing is imprecise. Lyme testing is imprecise. So we're going to wind up with people who are going to test negative for both, but could have one or the other, right? So you've got to look at the clinical symptoms, okay? Has the person been out hiking, in the grass, anywhere where it's endemic? You can get Lyme disease anywhere, I'd argue, but there may be areas that are going to be more common. So when taking a history, when thinking about what their patient's risk is, versus somebody was at a party indoors with people not wearing masks because they didn't think the risk was high, and 5 days later they're sick, right? I'm going to go more for a COVID diagnosis than a Lyme diagnosis. So again, exposures are going to be important. And early on, again, symptoms could be very similar. Fever, joint pain, very nonspecific, malaise, fatigue can overlap. I'm not going to say you can't get a sore throat with Lyme disease. It's a little less common. It may be more common with some of the other infections you can get from a tick bite. So a sore throat, congestion, cough, it's going to lean more towards a COVID diagnosis versus a Lyme. But the nonspecific symptoms, GI symptoms, nausea, vomiting, diarrhea, can actually be in both. So my concern is, yes, we're going to see an uptick in both, and we need doctors who are going to be trained to understand those two diagnoses and help patients, because I think too many patients are going to be ignored, and that's my biggest concern.
Oh, wow. It sounds, I mean, it's amazing. I'm looking at the numbers. The CDC is reporting over 300,000 Americans annually come down with Lyme disease. So it sounds like this just makes your job a little tougher, having to decide between one disease or another one that seems they're both horrible and you can die from both. But at least you can kind of narrow down where they've been. We just hope more people will be honest about where they've been. I see some people false reporting, like, I wasn't at a party, because they don't, like, you're not getting in trouble from your doctor for going to a party. Just be honest. That's how we are able to diagnose. So last question before you go. What do you think about COVID-19? COVID-19, as a doctor, are we doing the right thing? I'm not asking you, again, not to be political, but as a professional, have we done the right thing? Did we react in a timely manner? Are we going to be able to, I don't think we'll ever return to business as normal as a country, just because COVID's here and it's spreading like a wildfire. Our friends in Florida, we can thank for a lot of it because they seem to be ignoring it, and mask wearing seems to be this debate like we're taking people's houses from them, but we're saying wear a mask, right. And they're like, oh my God, I can't. It's like, okay, it's not guaranteed in the Constitution, folks, so stop trying to use the Constitution as your reason why you don't need to wear one. But do you think when it comes to COVID-19, that number one, we're doing a good job fighting it, and two, what does the future look like as a professional? Where do you see us going with COVID? I mean, people are saying it's here to stay. 2021, 2022, might be gone. And actually, my biggest question here is your thoughts on it in regards to school. I have school-age kids, so I'm asking selfishly. It's not often I get to talk to doctors. So, Doc, I got 2 kids. I want my kids to go to school. They want to go to school, but I want them to be safe. I want the teachers to be safe. I want the staff to be safe. I mean, safety is our number one concern. Before we were worried about shooters. Now we're worried about this little bugger, COVID-19. So what do we do?
Listen, I have school-age children too. Yeah. And I will tell you that I am, I'm terrified. Okay, I'm gonna be perfectly frank on this. You know, we're working on being better about prevention and spread of this disease, right? We haven't been perfect. In New York, you know, we have some leadership here who's done some really great work. And so New York was able to get the numbers down, and so we're in a better place. But it doesn't mean it's not spreading. It doesn't mean that we don't have cases here. And I can just imagine you put a bunch of kids in the room, it doesn't matter how old they are, and inevitably, whether it's 5 kids, 10 kids, I don't care, it's still possible. They're going to spread it. The teachers are going to get sick. And I have good friends who are teachers. And so I worry about the kids. I worry about the teachers. And so I have to say that, you know, from my perspective, we've got to find a better way to educate the kids. I'm not saying distance learning is great. Some kids do poorly with that, so that's not a solution either. And they don't get the social interactions that they need, and I get all that. But the concern I have about this virus in particular, compared to anything else that I've seen, but maybe in comparison to Lyme, the long-term effects of it are unknown. Okay, there are people who are being called long haulers. These are people who have had the virus, or they got sick with the virus 4 months ago, 5 months ago, early on. They're still sick. And we're seeing the effects of patients getting multisystemic infections, or multisystemic symptoms, and these patients developing very early signs of what we call ME/CFS. Chronic fatigue syndrome. And so I think that until we understand more, so number one, I want to educate doctors and patients to understand this long-term effect. And if we can intervene early and we can prevent the spread early, we're going to prevent the long-term damage. If we can't prevent it, then let's figure out how to treat the long-term damage. And if we're going to do all this, right, thinking about our kids is going to be, you know, of utmost importance. So it's a messy question, and I don't have the answers of how to do this. You know, I think what we're doing now is not perfect in many parts of the country. So, but I do, you know, again, my biggest concern is the long-term effects. I see this in Lyme disease. I see this in other viruses. COVID-19 is starting to act very similarly. And these are people who are, I'll say, relatively healthy, although I suspect that they had underlying immune problems to begin with. And then now their lives are never going to be the same.
Great answer. I mean, I just had to ask that. I mean, all of us with school-age kids, it's a huge concern to us. I think my opinion, which is nowhere near medical, was I thought we rushed back to open the country. I totally understand opening it. We need money. We have businesses. I'm a small business owner myself. I have lots of friends who are small business owners, but when I talk to my friends that are doctors, they disagree with me. They're like, we have to put safety first because this won't go away. These diseases don't go away. There's a lot of behind the scenes. It's not science. It's medical. You guys see it. You're on the front lines. You guys see it every day. We don't. Yep. And I think that's an important key. So I want to thank you so much, Doc, for coming on today and answering these questions, because it's key. Folks need to understand Lyme disease is big. It's all over the news. It's not just a WNBA thing. It just it's funny how that always brings the attention, right? I mean, people are like, oh, Lyme disease. Like, I was like, oh, crap. I kind of perked up when I read the article because I was like, wow, she's an all-star and she's being treated like garbage. And for having a disease, I was like, what is Lyme disease? I thought it was, honestly, I didn't even know what it was. I was like, Or is it? It's like, oh, that's not good. And I go out, we hike a lot. We live in the Pacific Northwest. So I do want to thank you, Doc, for joining us today. We will be
My
sharing
pleasure.
all of your links, and we'd love to have you back soon. We love talking about medicine stuff, medical stuff. It's always good.
I'd love to come back.
Awesome.
Sure, absolutely.
So thank you so much for joining us
Thank
today, and we'll be back real soon. Just kidding. We're not going back to the next messages yet. I just want to wrap up